Hi, Daigle team. Welcome to this month's Daigle Safety Talk. Today we'll be covering bloodborne pathogens. What are bloodborne pathogens? Bloodborne pathogens are microorganisms such as viruses or bacteria that are carried in the blood and can cause disease in people. The big four bloodborne pathogens include hepatitis B, HPV, hepatitis C, HCV, human immunodeficiency virus, HIV, and acquired immune deficiency, or AIDS. Transmissions occur by blood spills, sharps, broken glass or needles, and cleaning of feminine products. Please remain cautious and alert when handling these items or debris. Prevention from exposure. How to prevent exposure to BPPs. Protect personal protective equipment. Properly using and removing. Proper disinfectant chemicals use and exposure times. Proper disposal of contaminated debris into biohazard containers. And cleaning laundry exposed to blood. When using PPE in the field, you should make sure that you are utilizing it properly and removing it properly as well. Gloves should be examined for rips and tears before cleaning any types of blood. Remove your gloves by using the fold and tuck double fold glove technique and allow no part of the contaminated glove surface to touch your skin. Wash your hands immediately after glove removal. Disinfectant chemicals. Disinfectant chemicals that we use in the field have certain exposure times that will kill the bloodborne pathogens, such as Avastat D. Has a 3-minute contact time on hard, non-porous surfaces. These surfaces are solid and sealed. It has a 1-minute wet surface contact time to kill HIV, HBV, and HCV. After the contact time is over, you should wipe the surface with a clean rag and allow it to air dry. You also utilize Envirox or H2 Orange. It has a 5-minute contact time to kill bloodborne pathogens. And when cleaning laundry that was exposed to blood, temperature should be 140 degrees or more. You should separate the clothing or item that was exposed to blood from the normal laundry. Use bleach for whites and use peroxide or color-safe bleach for colors. Encountering BPPs at DCS. As a rule at DCS, we do not clean or pick up blood-contaminated items in order to ensure your safety on the field. If you do encounter a blood-contaminated item or space, please inform your immediate supervisor. The client will be required to deal with this item or space. If you are exposed to a bloodborne pathogen, you should immediately wash the exposed area with soap and water and flush any splashes to your eyes, nose, or mouth with water. Wash needle sticks and cuts with soap and water, and report all exposures promptly to ensure that you receive appropriate follow-up care.